So those are your PO meds, medication everywhere here, right? Lots of medication administration. Whereas the titration and venous devices and blood administration and TPN and all of that would also be included with the RN's pharmacological and parenteral therapies. All right, we're all going to be looking at reduction of risk potential, okay, and that's about responding, okay, to an emerging crisis, okay, or heading it off before it becomes a crisis because you have analyzed the data to figure out what's going on. You're heading off a problem, reduction of risk potential. So there could be a risk coming to the client. Maybe they're deoxygenating fast and you have a way where you can apply the oxygen via nasal cannula and restabilize the patient. All right, so it's about responding, intervening, and maintaining homeostasis and not letting them trend out to an attack or any kind of other exacerbation that you do not want for your client under your care. All right. And then finally, physiological adaptation. All right. These are the patients who have the trachs and they're on hemodialysis or they have an ileostomy. These are the folks who have perfusion issues and they're postoperative patients. These are our sickest patients who tend to have invasive procedures happening. Maybe they're on telemetry. Maybe they have their hemodynamics being monitored because they had some kind of placental abruption. Something bad happened. Okay, something, it's beyond reducing the risk, something happened, okay? Maybe they're post-surgical and they require you to really focus in on the issues that they may have coming up because you don't want them to decompensate.